Hello, my name is Tom Lucas and I'll be presenting on panic disorder. This presentation is for California Southern University Psych 8724-8B, Dr. Mahaffey's class. Panic disorder is classified as an anxiety disorder in the DSM-5-TR. That's the American Psychiatric Association 2022 version, and it involves a combination of physiological and psychological effects experienced by those that suffer from it. Now, listed here are some of the most common symptoms reported, generally peaking within minutes. However, most patients also report strong, often disabling fear about future attacks, which leads to avoidance. And what they have experienced is triggers such as locations and situations associated with those previous episodes. In this cascade of events, a person experiencing panic attacks suffers not simply in the moment of the attack, but also life-altering fear in an ongoing process. Understanding the effective treatment options that are available to manage and overcome this condition is essential. The question is, what causes these reactions? Well, Kim, 2020, argues that panic disorder is a prevalent anxiety disorder affecting between 2.1% and 4.7% of the general population. At some point in their lives, this condition typically follows a chronic course, resulting in substantial economic consequences and a decreased quality of life. So let's take a look at some of these causes. Panic is a complex emotional reaction involving abnormally high levels of anxiety and fear, Pittman 2015. There are multifaceted physiological processes at play that occur when an individual experiences panic. The activation of the sympathetic and parasympathetic nervous systems is accompanied by a dysfunction or dysregulation of the amygdala and the neurotransmitter system. This is evident in the interaction between GABA, the calming hormone or calming neurotransmitter, and glutamate. Additionally, elevated levels of cortisol and adrenaline cause further amygdala agitation and activation, leading to dysfunctions in serotonin and norepinephrine. These physiological processes are the cause of the physical effects of increased heart rate, increased respiration, muscle tension, and the shunting of blood flow from the extremities to the vital organs. Additionally, the prefrontal cortex, which is crucial for executive judgment and decision making, may shut down. Here are a few of the primary anxiety disorders listed in the DSM. We have panic disorder, we have general anxiety disorder, mixed anxiety and depressive disorder, and other specified and unspecified anxiety disorders, APA 2022. Panic disorder can be associated with or without agoraphobia. Now, agoraphobia is another type of anxiety disorder involving the fear and avoidance of places or situations that might cause the feeling of being trapped, embarrassed, or helpless. Some people develop agoraphobia in response to their panic attacks. Now, the fear of future panic attacks then becomes the primary negative symptoms to be addressed in the treatment process. The sympathetic system is triggered when we perceive a threat or a dangerous situation. The parasympathetic system is triggered once that threat or perception of danger is resolved. In normal physiologic functioning, the parasympathetic system is designed to activate when we're at rest and during our digestive function periods. Its main job is to promote relaxation, acting as a brake to the fight, flight, freeze reactions. The blood starts to flow back to the outer limbs. The parasympathetic system kicks in, trying to put the body and the mind back into a state of homeostasis. In response to danger or a perception of threat, high levels of stress or anxiety, the brain responds by either defending itself, fight, running away, flight, or simply stopping, freeze, Pittman 2015. This really depends on past experiences, a person's response to threats, and how their responses manifest in different ways. This freezing is often referred to as fawning which could present in several ways. It's essential to remember that whether it's fight or flight or freeze, an individual's body reaction is based on their sympathetic nervous system and their response to the perceived level of danger or threat. This is designed to help the person survive under dangerous, stressful, or life-threatening situations. So anxiety is neither good or bad, it simply is. Anxiety can serve very useful purposes and provide a helpful function. However, it can also be detrimental to somebody's life. So what are the amygdalae? Well, they're structures positioned behind each eyeball, and they play a critical function in anxiety and panic disorders. When we perceive a threat or imminent danger, the amygdala goes into hyperdrive. Now, under PET scans, we can see the amygdala light up like a Christmas tree with threat activation. The amygdala cues the body and the brain to release certain neurochemicals and hormones, Pittman 2015, including adrenaline and cortisol. In addition, we see the secretion of neurochemicals such as serotonin, dopamine, and norepinephrine. This tells the body that there's an imminent threat, therefore the body prepares for action with physical changes noted earlier. This reaction will continue until the brain perceives that it is in a safe place. However, if one realizes that their anxiety is irrational or illogical, there are specific techniques that can be used to calm down and cool, if you will, the amygdala, which we will discuss later. The amygdala pathways, or the amygdalae pathways, are complex and integral to the body's responses. Cook and Artino discovered a strong connection between the olfactory bulb and the emotional regulation of the amygdalae. Our sense of smell reflects, to some degree, how we feel. It affects our emotions. Shackman and Fox, 2016, emphasized that anxiety disorders impose a significant burden on public health, highlighting the necessity for a much deeper understanding of the neural circuits that underlie extreme fear and anxiety. Now, recent research underscores a crucial role of the central extended amygdala, particularly the central nucleus of the amygdala, the CE, and the adjacent bed nucleus of the stria terminalis, called the BST. Anatomical studies reveal that the CE and the BST form a highly interconnected network, allowing for the integration of various types of threat-relevant information to construct states of fear and anxiety. Now, neurotransmitters engage in this stress response, and research into the causative and correlating pathways is fascinating. In one study, Nicholas et al. 2010 discovered a strong link between dopamine and obsessive compulsiveness. Research is ongoing to the role of many significant correlations. Systems, which consist of networks of neurons that utilize monoamine neurotransmitters, also play a crucial role in regulating emotion, arousal, and certain types of memory. Kumar and Kaur, 2013, discussed the vital role of hormones in the panic response and how they play havoc with our endocrine or endocrine system and general wellness. Assessing hormone changes is essential for a comprehensive understanding of the causes of panic disorders. Now, science has not yet proven precisely why some people experience panic attacks and others do not. The brain and central nervous system appear to play key roles in how fear and anxiety are experienced by each individual. Researchers have identified that all of the previously discussed systems contribute to the development of panic disorder. Other factors are also involved. There is a cognitive perspective. Let us start with the cognitive perspective. Each of us views the world through a unique set of filters and lenses shaped by our experiences, opinions, and beliefs, and our attitudes. This is at the heart of our interpretations and appraisals. Processing information is not just how or what we see, but really how we make sense of it. Now, Dr. Tim Aaron Beck's research highlights that our emotions and behaviors are profoundly affected by our cognitive processes. Beck and others, 1979. In fact, Cook and Artino, in 2016, argued that all motivational theories are inherently connected to a mental component or a cognitive element as learners approach tasks with their past experiences and social supports in mind. Furthermore, Dr. Ellis's rationally motive behavioral therapy resonates with the Stoic philosophy, emphasizing the power of our thoughts and interpretations in shaping our emotional responses. Ellis and Ellis, 2019. Our appraisals don't dictate our feelings or actions outright, but they heavily influence how we react to various situations. O'Donoghue and Fisher, 2009. Our biological perspective is we can't overlook the biology. Inaccurate appraisals can and do trigger a cascade of physiological responses. These responses can then manifest as sadness, fear, anger, panic, and even major depression. This is where cognitive behavioral therapy shines, helping individuals to identify the body's adaptive processes as a way to understand cause and reaction, and then the ability to develop more accurate constructive appraisals and coping strategies. Now, Beck and others in 1979 found that by understanding this connection, we can empower ourselves and others to break free from the grip of distress. Simpson and Balsam, 2016, assert that all animals are driven to fulfill their fundamental needs of food, water, reproduction, social interaction, crucial elements for survival and overall well-being. They define motivation as energizing behavior in pursuit of a goal. The regulation of motivated behaviors is biologically accomplished through the coordinated actions of various molecules, including peptides, hormones, and neurotransmitters. The third perspective is the evolutionary perspective. We have to acknowledge our evolution. Our ancestors faced dangers that instilled an inherent anxiety and fear. Although we no longer face the saber-toothed tiger, our amygdala can be stimulated to react as if we were in peril. Now, Shackman and Fox, 2016, argue that we inherited a propensity to be afraid. This is why we've survived. This is why the human being has evolved to the current time. This primal fear underscores the importance of accurate appraisals in maintaining emotional health. By learning to navigate our cognitive processes, we can reclaim control over our emotional states and reduce the impact of these ancestral fears. I have a personal interest in the treatment of trauma, particularly in the overlooked concept of intergenerational trauma. This is a captivating area of research. Epigenetics, a rapidly advancing field, examines how trauma can influence gene expression. While it does not alter the DNA itself, observable changes can occur in how the body interprets that DNA. Since DNA is passed down through generations, there's a theoretical basis for inheriting aspects of trauma. Is it possible that we also inherit panic and anxiety and depression? Regardless of whether this inheritance is scientifically substantiated, the impact on subsequent generations is significant, independent of its inheritance status. Ryder, 2022. As with many of the psychiatric disorders mentioned in the Diagnostic and Statistical Manual, panic disorder can be comorbid with a variety of other mental health and/or physical medical conditions. Many of these comorbidities are listed in the DSM-5-TR, APA 2020. As far as treatment, there are many evidence-based treatments available for panic disorder, including psychological and medication therapies, medical consultations, and appropriate lab tests to rule out any underlying medical conditions like thyroid imbalance are essential. Cognitive behavioral therapy is often recommended along with pharmacological evaluation that may include medications like duloxetine, Prozac, Effexor, or Lexapro. Benzodiazepines should be used with caution due to their dependency issues. Mindfulness-based therapies include mood journaling, exercise routines, relaxation training, yoga, meditation practices. They all have evidence for success. Other therapeutic approaches may involve behavioral therapy and exposure therapy. Combination therapy is often used, and that would be when we take two or more of these therapies and combine them to give a more infused effect. Now, selective serotonin reuptake inhibitors, the SSRIs, are reliable and safe, and they're a great choice for treating panic attacks, thanks to their low risk of serious side effects. They're widely recognized as the first line of treatment. The SSRIs are approved by the Food and Drug Administration, the FDA, for panic disorder. The approved medications include fluoxetine, Prozac, paroxetine, Paxil or Paxiba, and sertraline, Zoloft. Serotonin and norepinephrine reuptake inhibitors, SNRIs, offer another effective class of medications. Venlafaxine, Effexor XR, and SNRI is also FDA approved for the treatment of panic disorder and demonstrates significant efficacy. We also have the benzodiazepines. They are potent sedatives and function as central nervous system depressants. Now, several benzodiazepines, including alprazolam, Xanax, clonazepam, Klonopin, are FDA approved for panic disorders. Now, while these medications are effective, they're best to use for short-term relief due to the potential for habit formation and the risk of mental and physical dependence. They're not advisable for those with a history of alcohol or drug issues, and they may interact negatively with other medications, heightening the need for caution. Beta blockers are also used. In addition to SSRIs and SSNRIs and benzodiazepines, beta blockers have shown some success in lowering levels of anxiety and panic. These beta blockers can help with the physiological aspects of anxiety, lowering that heart rate, respiration, blood pressure, and muscle tension. This is vital to giving the patient the opportunity to use cognitive skills to address panic. Dua et al. In 2024, they discussed the important role beta blockers can play in the treatment of panic attacks and panic disorder. Their research shows increased symptom management by combining beta blockers with SNRIs. Now, it's crucial to consider the individual patient profile when considering any combined therapy. Therapeutic techniques. When it comes to therapeutic techniques, the gold standard has always been cognitive behavioral therapy, thought challenging, thought records. It helps a patient challenge their own dysfunctional thoughts and examine their behaviors in response to anxiety triggers. Bett and others, 1979. Ellis, 2019, argued cognition was the primary driver for anxiety and panic. Another popular therapy, which is showing success in the treatment of panic disorder, is acceptance and commitment therapy, or ACT, a process in which an individual stops the struggle with troublesome thoughts and feelings and learns how to identify and accept these feelings while focusing on value-branded living. Leon et al. 2025 conducted a study showing CBT was actually more effective than ACT for treating panic. However, more people dropped out of the CBT group as compared to the ACT group. O'Donoghue and Fisher in 2009 discussed the empirical evidence behind CBT and its success in treatment. Mindfulness, of course, is another important tool that helps to put the person in the now and reorient their cognitive and physiological status. Group therapy has long been used for successful treatment of anxiety and panic disorders because it gives a person a form of universality, a sense of being and belonging, and interacting with people that have similar reactions to panic, and understanding that they're not alone. Exposure therapy is extremely helpful when we incrementally expose individuals to the stimulus that is disturbing them or causing them problems in their day-to-day life. The influence of social and cultural factors on emotion and motivation is profound, making it crucial to consider these elements in evidence-based practice and treatment planning. Culture and societal influences play a vital role in shaping individual development, impacting our identity, thought processes, emotional responses, and our worldview. It's essential to consider these factors before formulating treatment strategies and implementing evidence-based interventions. Without a knowledge of cross-cultural issues and values, we'd find it difficult to enter a helpful therapeutic relationship with those who are different from ourselves. A deeper connection and understanding of the individual across from us promotes empathy and a therapeutic relationship. It's also essential to develop an attitude of not knowing. The therapist should avoid stereotypes. One should never assume that all people from a specific group share the same reality or even the same core values. Lee, 2019, argues that each client is an individual first. Marsiglia and Boo, 2025, discussed the benefit of utilizing the cultural formulation interview. The DSM-5 TR discusses the CFI and how it aims to improve culturally sensitive diagnoses and treatment by focusing clinical attention to the patient's perspective and social context. It takes about 20 minutes, according to the APA 2022. Research should examine how best to ensure the CFI elicits these aspects of patients' lives and experiences. Napier and others, 2014. Addressing the health needs of marginalized clients, immigrants, and people from different cultures is crucial for health equality, as well as responding to issues of structural violence and marginalization. Culture is a critical aspect of what we do in an understanding ending mental disorder. Well, thank you for your time. This is the end of the presentation. And following this slide, we'll take a look at some of the references that were utilized in the production of this assignment. Thank you.